Hello everyone, welcome to my channel. This is Kanika Arora and you're watching my channel The Medical World. So our today's topic is about the nursing management of the seizures. In this video, we will learn about the nursing assessment and the whole process of care, how we will deal as a nurses to and how we will care for the clients with the seizure. So let's move to the video. First of all, we have to know what to assess as a nurse when the patient is having the seizure. Firstly, it is very important to take the history. The diagnosis of the epileptic seizure is made by analyzing the patient's detailed clinical history and by performing the test for the confirmation. Someone who has observed the patient's repeated events are usually the best person to accurate history who provides, and however the patient can also provide the details if he or she suffers or if he or she is having such symptoms such as aura, preservation of the consciousness, and some of the post-etal stages. And the second assessment will be the physical examination. We all know that physical examination is very important because it helps in the diagnosis of the specific epileptic syndromes that can cause the abnormal findings. Which are the abnormal findings? Such as the neurocutaneous syndrome, such as the cirrhosis, and others. And also, patients who have been suffering through this type of seizures have are likely to have the more injuries, such as stitches, because when they have this condition, they are more likely to get injury if no one is there or they do not get the proper supervision. Next one are the nursing diagnosis. So what will be the nursing diagnosis? First one is the risk for trauma or suffocation, which is related to the loss of large or small muscle coordination. Remember, these all diagnoses are made according to the Nanda, and you have to go always accordingly to that. So second diagnosis is the risk for ineffective airway clearance related to neuromuscular impairment. Third one, situational low self-esteem related to stigma associated with the condition. Fourth one, deficient knowledge related to the information misinterpretation. And the last one is the risk for injury, which is related to weakness, balancing difficulties, cognitive limitations, or altered consciousness. Next step in the care of process is the nursing planning and goals. The nursing goals for the child with the seizure disorders are: the patients or the caregiver will verbalize understanding of the factors that contribute to the possibility of the trauma or of the suffocation and take steps to correct the situation. Next is to identify the actions or measure when seizure activity occurs. Then it also helps to demonstrate the goals, lifestyle changes so that the injury can be protected. Then is to maintain the treatment regimen to control or eliminate the seizure activity, to modify the environment as indicated to enhance the safety, to demonstrate the behavior to restore the possible self-esteem, to maintain the respiratory pattern with airway patent or respiration prevented, to verbalize understanding the disorder and various stimuli that may increase the seizure activity. Nursing interventions. Here are some nursing interventions that are jotted in the form of points. First is the prevent the trauma. How the trauma can be prevented? Teach the SO to determine and familiarize the warning signs and how to care for the patients during and after the seizure attack. Avoid using the thermometers that can cause breakage. Use tympanic thermometer when necessary to take the temperature. Uphold the strict bed rest. If primordial signs or aura experience, turn head to side and suction airway as indicated. Support head. place on soft area or assist to floor. If out of bed, do not attempt to restrain. Monitor and document the drug levels corresponding the side effects and deficiency of seizure activity. Second intervention will be promote the airway clearance, maintain in lying position, flat surfaces, turn head to side during seizure activity, loosen clothes from neck or chest and abdominal area, suction as needed, supervise supplemental oxygen or bag ventilation as needed. Third intervention will be improve the self-esteem, determine individual situation related to low self-esteem in the present condition, encourage activities, provide supervision and monitor when indicated. Know attitudes or capabilities of the seizure patient, help an individual realize that his or her feelings are normal. However, guilt and blame are not helpful. And the last nursing intervention will be enforce the education about the disease. Explain patient proper about whole disease, how it occurs, so that the patient can be understandable and should have the less anxiety, and also look after the triggering factors. Documentation guidelines, how we have to document and what we have to document. First of all, the individual findings should be documented, including the factors affecting interaction, nature of social exchange, specific of the individual behavior. Second one is the culture and religion belief and expectations. Third one is the plan of care. Fourth one, teaching plan. Fifth one is the responses to intervention, teaching and actions performed. And the last one is the attainment or progress towards the desired outcome. Thanks for watching this video. I hope you all like this video. If you like this video, please don't forget to subscribe my channel and click on the bell icon for daily updates. Thank you so much.